Hello and welcome everyone. Today our topic of discussion is viral hepatitis. Introduction. Hepatitis means inflammation of liver. Hepatitis is caused by viruses. Clinical picture can be vary from acute condition and chronic sequel to chronic active hepatitis and cirrhosis. Main viruses includes hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. Now let's learn about hepatitis A virus. Hepatitis A is a picornavirus of Picornaviridae family. It is a small non-enveloped virus having positive single-strand RNA which has a linear genome. The capsid is icosahedral. Transmission of hepatitis A virus occurs through fecal-oral route. Incubation period is around 28 days. Symptoms include nausea, vomiting, diarrhea, abdominal pain, loss of appetite, fever, jaundice, itching. Diagnosis of hepatitis A usually done by testing of IgM antibody in the patient's serum. Hepatitis A IgM is found in serum within 1 week from the onset of symptoms. It is a diagnostic for acute infection. Management include mainly supportive care like rest, adequate nutrition and fluids to help relieve symptoms. No specific treatment available for hepatitis A. And there is inactivated virus vaccine available for prevention of hepatitis A virus infection. Hepatitis E virus. It is a hepavirus of Hepiviridae family. It is also non-enveloped, positive, single-stranded RNA has a linear genome. The capsid is icosahedral. It has a 4 genotypes. All genotypes affects humans, but only 3 and 4 affects animals. Transmission is by fecal-oral route. Symptoms include either it is asymptomatic or may develop mild self-limited HAV-like illness. Incubation period is ranging between 2 weeks to 10 weeks. The most important feature of hepatitis E virus infection is that if the infection occurs during the pregnancy, it can convert into hepatic failure. Diagnosis. Diagnosis is mainly done by antibody detection in the serum. Anti-HEV IgM antibody confirms acute infection. And HEV viral RNA load in the serum or feces is a confirmatory test. The management includes no specific treatment, only supportive treatment. Let's learn about hepatitis B virus. The virus is Hepednavirus of Hepednaviridae family DNA virus. It is enveloped, having circular genome. Capsid is icosahedral. The DNA of virus is partially double-stranded. After entering into the host cells, it becomes fully double-stranded. Virus uses reverse transcriptase enzyme just like HIV. The source of enveloped is endoplasmic reticulum. The transmission of hepatitis B virus occurs through sexual contact, IV route such as drug abuse, transfusion, needle stick injury, mother to fetus, especially if mother had acute hepatitis in a 3rd trimester of pregnancy. Incubation period is 1 to 4 months. Symptoms include mild hepatitis to icteric hepatitis, can convert into chronic hepatitis B. The risk of progression of cirrhosis, liver failure, HCC and reactivations are very high. Extrahepatic manifestations include polyarteritis nodosa and glomerular disease. The diagnosis is mainly done by antigen and antibody detection in routine testing. The antigens are hbsag and hbeag, and antibodies detected are antihbs, antihbe, and antihbc antibodies. Once the hbsag is positive, we can state that the person is infected with hepatitis B virus. After recovery from acute infection, hbsag can become negative after 4 to 6 months. After this 4 to 6 months, there is still a period after which the antibody to HBs rise. So there is in between period which is called the window period, in that only antibody to HBc is positive. If hbsag is negative, then we can state that the person is not infected with hepatitis B virus. If hbsag persists more than 6 months, then we can state that this is the chronic infection of hepatitis B virus. If any person has taken a vaccine for hepatitis B virus, then only anti-hbs antibody is positive and all other antigens and antibodies are negative. The HBC antigen, it is a capsid core protein expressed by infected hepatocyte and it never present in the serum, so it cannot be detectable in the serum. hbeag is a viral protein secreted by infected cells, correlates with the viral replication increased in highly infectious patients. An HBV DNA virus mainly detected by PCR method, which is useful for viral load estimation. This is the hepatitis B profile. Shortly after the exposure, hbsag is begin to rise along with hbeag, and after that anti-hbc total begins to rise. If it is an acute infection and it is cleared after 6 months, then hbsag becomes negative and there is some period between which anti-hbs formation occurs and detectable. This is the window period. In this window period, only antibody present is anti-hbc total. The hepatitis B vaccine is made up of recombinant molecule of hbsag. The management mainly includes supportive care and antiviral drugs for chronic infections. Hepatitis C virus. It is a flavivirus of Flaviviridae family. It is a small enveloped positive single-stranded RNA in a linear genome. Capsid is icosahedral. It has a high degree of antigenic variation which is responsible for chronic infection. Transmission is by mainly sexual contact, IV route and mother to fetus. Symptoms include asymptomatic in acute phase and other non-specific symptom, and accidental elevation of LFTs can be identified in the serum. Extrahepatic manifestations include hematological abnormalities, glomerular disease, dermatological disorders, rheumatologic complaints, neurological involvement, autoimmune diseases. The risk of complications include cirrhosis, hepatic fibrosis, hepatocellular carcinoma, liver failure, and it is a common indication for liver transplantation. The diagnosis of hepatitis C mainly routinely done by anti-HCV antibodies and HCV RNA PCR. Management includes antiviral drugs. Hepatitis D virus. It is Delta virus. It is negative single-strand RNA virus considered as a defective virus that requires the existence of hepatitis B virus for full expression and replication. It is a small, enveloped, negative single-stranded RNA with circular genome. It is a co-infector, only infects cells which are already infected by hepatitis B virus. If it occurs with HBV infection, then it is called the co-infection. And if infection occurs in chronic hepatitis B carriers, then it is called superinfection, which leads to hepatitis flare. Diagnosis is mainly done by HDV RNA by PCR, HD antigen and anti-HDV antibody detection. The vaccination against hepatitis B virus protects against hepatitis D virus infection. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.